Do you have a preference which one I do first, or doesn't
Um,
matter?
we can just start with potty training, I guess. Yeah.
Um, and are you able to see my screen? I think you can. Okay. Start the slideshow. So I'm gonna be going over like when to start potty training, how to train, and then when something might go wrong during the process. Um, so when is your child ready for potty training? It depends on a little what you consider potty training and how independent you want the child to be. Different cultures around the world start at different times. Some countries start early at 6 months, but that seems really early. In the US in the 1940s, we usually start in around 18 months to 2 years. And the average age for urine control for girls is about 32 and a half to 35 months. And sorry, and 35 months for boys. And then for stooling, when they can start to control it, is 31 and a half months for girls and then 35 months for boys. But usually around 18 months is when we said you can kind of start training. Um, what to look for to decide if your child is ready. If they can follow simple directions, they can stay dry for 2 hours. If they can tell you if they need to go to the bathroom, and if they actually want to use the potty or like want to sit in the potty, and if they can pull down their pants and actually either climb up with a step stool or tall enough to sit on the potty. So there's two different approach on how to go about potty training. The first one is the child-oriented approach. This is the preferred method from the American Academy of Pediatrics. This method can take weeks to months to complete, and then you start when the child starts to show signs that I just discussed that they're ready for potty training. Um, so first you need to teach a child the words that they're going to use, like I need to go pee, I need to poo, or I need to tinkle. And then you kind of also talk about the anatomy, like, oh, like penis or bottom. And then you can either use like a small mini potty chair, or you can also get the one that you put into the seat. And then you want them to just observe family members as they're going to the potty, and then just tell them like, oh, I'm going to the potty, I'm going to wipe, and I'm going to flush. Kind of verbalize every process that you're doing. Um, to get the child to sit on a potty, there's like Elmo videos or Elmo books that you can use that I also use for my own son during the potty training, and he gets them kind of excited about potty training. Um, and then after they sit on the potty, you can kind of reward them. And if just for sitting, I give them like one sticker. And then if you have to sit for 10 to 15 minutes, usually after meals, but that's usually kind of stimulates your stomach and make you want to go. And then offer them a lot of uh, positive enforcement. Um, and if they actually go to pee or poo, then you give them more stickers. And always with positive reinforcement. You never want to like punish them if they have an accident or anything. Another time to encourage potty training is having them uh, early in the morning when they first wake up, um, 15 minutes after meals, and then before bedtime too. And then this is the second approach is more of like a parent-oriented approach. It involves complete attention of the parent or caregiver for like the whole 24-hour, sometimes 2 days. This method is also used when the child seems to be ready for potty training. Um, then you basically train in a day. So you first start with a doll that can pee into the potty chair to show the child the desired behavior. You want them to kind of copy the doll. And then you give the child lots of fluids, pretty much juice, water, like throughout the whole day. And then have the chair ready. And some people have it in their living room, so as soon as the child's playing, you can just rush them into the chair. And you want them to have be in the underwear instead of diapers. And then you want to check that they're dry every 5 minutes in their underwear, and then you give them a reward for being dry. And then every 30 minutes, you want them to sit on the potty to kind of get them practice to go to the potty. And if they do have an accident, tell them it's okay, but they need to stay dry, and you change out um, into a different underwear. So you'll be going through a lot of underwear with this method. So basically, you do it every 30 minutes until they have a successful potty. But if your child has any developmental delays, potty training may take longer or may not occur around 18 months to 24 years. At that time, you should probably talk to your pediatrician if you're not having success after a few months or if they're not trained by 4 years of age. And then sometimes kids, once they're fully potty trained, they might start wetting the bed again after 3 months. But bedwetting is normal up until age 5. And then you want to make sure when you start the potty training process that everyone in the family is using the same approach. It could be very stressful during this time, especially if you have another baby or you have other things to do, especially if you have to go to work and if their baby's in childcare. So you have to also tell them the childcare place that you're also potty training. It could be a power struggle. Sometimes toddlers want their independence and they might resist or they might be scared, but keep on trying, making sure you're staying positive and don't give up. And then some problems that they could have, if they're afraid to go to potty, they might not want to go to poop and they actually will actually hold it and cause constipation. But we'll talk about that in the next slide. But fully potty training may take up to 6 months. Okay, so nighttime dryness. Staying dry through the night is usually the last part of potty training. The biggest factor is when the child is neurologically mature, they need to be able to stay dry for long periods and they sense the need to toilet even in deep sleep. The age when they actually achieve night dryness varies, but 80% by 5 years old. If one or both parents had bedwetting when they were a kid, it's likely that the child might have bedwetting as well. But don't ever punish them or put the child's mood down for bedwetting. And this was stool holding. So once a child learns to control when they have a stool, if they have a negative experience, like a hard, painful stool, they would try to hold it. The more often they hold the poop, the longer they can go, and it can also stretch the rectum. So some strategies to kind of help with the constipation is to increase plenty of fluids, prune juice, and increasing fiber in the diet. But if they're holding their stools or skipping multiple days without pooping, you should definitely talk to your doctor. These are two books that I use for potty training for my son. And I have a PDF for the Laura Jensen one that I can send to Alyssa if anyone's interested. But basically it's kind of like the parent approach where you're home for the 3 day and then just kind of focus on potty training and just having them sit every 30 minutes in the potty. Um, any questions? That concludes the presentation. And I want to thank Dr. Kudos for giving me these slides. Let me check the chat box too.
Does anyone have questions specifically about potty training for Dr. Lee before we move on to sleep routines? You can either unmute yourself or put it in the chat.
Okay, so like my daughter knows how to like do everything, like go to the potty and everything, but it's more like when she sits on it, she doesn't feel like going and she'd rather go in like a diaper or like a flip. So how do I help her like reinforce going in the actual potty?
So sometimes when the child's actually sitting on the potty, you can also like open the faucet and kind of have that noise of the water trickling. And then I usually like sit with my son. He didn't want to go to the beginning. And I would just sit there for like 10, 15 minutes just singing to him or having like the Elmo books or videos of other kids pottying, kind of help. And then I usually just give her a reward just for sitting on the potty, like stickers. I think the book that I use, they recommend like M&Ms, but I mean, that's up to you if you want to give candy as a treat. But
Okay.
just keep on trying. And eventually, once they have that first tinkle, they're like so happy they're just gonna want to keep doing it.
Okay.
Any other questions? I'll put my email address in the chat box too if anyone has questions after the presentation. And I can send a list of the PDF too of the book that I have.
That would be great, Dr. Lee. I think that book would be a great resource.
Okay.
Yeah, I would be interested in the book as well.
Okay.
Maria, could you real quick give everyone a reminder on how to switch to Spanish? I think we had some people join in the middle that might be struggling.
Should I go ahead and start the sleep hygiene presentation?
Are there any other questions, anybody? Okay, then I think we can move on.
Okay, great. Okay, so this will be on sleep hygienes. So how many hours does your child sleep? So the recommended number is usually higher than what we probably think. So according to the National Sleep Foundation and American Academy of Sleep Medicine, newborns from 0 to 3 months should be getting at least 14 to 17 hours. Infants from 4 to 11 months, they should get at least 12 to 15 to 16 hours. For kids 1 to 2 years old, they should get at least 11 to 14 hours. And then preschool age from 3 to 5 should get about 10 to 13 hours. And older kids, 6 to 13 should get 9 to 12. And then teenagers should get 8 to 10 hours. So those are just roughly how much you want to aim for to be considered adequate sleep in your child. So consequences of not getting enough sleep. Some studies show that it can lead to being overweight, being obese, actually being hyperactive. You would think if a child's sleepy, they'll be tired, but it's actually the opposite. They'll be more active. They won't be very focused. And then there was an article I read that when they're older, they tend to be a little more aggressive, have some anxiety, depression, and it can also affect their memory if they're not getting enough sleep. What are some problems that cause them to have sleep problems? So having nightmares, having night terrors, bedwetting, having restless leg syndrome, snoring, sleepwalking, and having like a lot of screen time. I'm going to talk about each of these topics individually and how to address them. So nightmares, they're common in children from 3 to 6 years old, and it tends to peak at 10 years old. And then after that, the frequency of nightmares tends to decrease. This may cause them to be scared, sad, or angry to go to bed. So you want to make sure that that they know that these dreams are not real, and that it's okay if they have them. It's normal. There's nothing wrong with them. You can try to use like a dream catcher, and also you can have like a blanket or an animal or a toy that they really like and give them a lot of security to help them sleep at night. Another method I think is pretty good is having them write up the nightmare in a paper and then ripping it up. So it kind of gives them a sense of control over their nightmares. And you want to make sure they're openly talking about it because sometimes kids can be very anxious about sleep. So having an open discussion can help. And then nightmares are very similar to night terrors, but night terrors is usually when a child is screaming, shouting, and you can't really comfort them. They're actually still asleep and you can't wake them up. And when they wake up, they have no memory of it. So with nightmare, they're able to tell you what it is, but with night terrors, they won't know. And this usually happens between 4 to 12 years old. There seems to be a genetic component. If parents had it, the child might have it. So when they're having this night terrors, you just want to sleep with them and kind of sit and wait for them to fall back to sleep again. And then you can also keep a sleep diary and see if there's a certain time of night where the child wakes up. And then if you notice like, oh, a certain time, like 8 or 9, then you can wake them up 15 minutes before that time to kind of help prevent the night terror from occurring. But the best way to avoid this is to establish a good sleep routine and making sure they're getting enough sleep. Usually they outgrow the night terrors though. Bedwetting. So bedwetting is normal up to 5 years of age, but if they're wetting the bed, obviously they're going to wake up in the middle of the night and have disruption in their sleep. But if they are having that, you also want to see your pediatrician or your family doctor to see if there's any other causes of bedwetting, whether they're having like a urinary tract infection, if they're having another like a medication that could be causing them to have urine leakage, or if they're constipated, sometimes their belly is so full that it can press on their bladder and cause them to go back to bed at night. Like I said earlier, there's a genetic component to bedwetting, but oftentimes kids will outgrow this. But some things you could try is have a bedwetting alarm, which is shown in this picture here, where as soon as the bed is your underwear is a little wet, it'll send a little signal and it'll wake the baby up and the child up, and then you know to go to the bathroom. But you definitely want to avoid drinking any liquids 3 hours before bedtime. And then if you really want, there's oral medications that you can take too to kind of help with the urine control. Restless leg syndrome. So this is kind of like a crawling or tugging or itching or tingling sensation that the child feels in their leg. They might not necessarily feel pain, but they just feel like something like a cramp. So that time you should bring up to your doctor, and then they should check iron levels because there's some association with low iron levels and having restless leg syndrome. And oftentimes, if your levels are low, you can get iron supplements. And then sleepwalking. So this tends to occur between children 6 to 12 years old. It tends to run in families and affects boys more than girls. It could be related to sleep apnea, which I'll discuss later on. But if a child is sleepwalking, you definitely want to make sure you're keeping the windows and the doors locked, make sure their environment is very safe. If you're having bunk beds, don't have them sleep on the top. Keep any sharp glass objects, any dangerous items away from the child's bed and out of the bedroom. And if you're on the second floor, making sure that you have a gate so they don't fall down the stairs. And then if the child is sleepwalking, you don't want to hold them down, but kind of just escort and walk them into the bedroom and place them back in bed. And usually sleepwalking, they outgrow it with time. And so snoring or sleep apnea. So if your child is having like noisy breathing, or they're sleeping with their mouth open, if they seem very restless or sweating a lot at night, and during the daytime they seem very sleepy, we might want to bring that up to your doctor and then kind of work them up for sleep apnea. You also can kind of, if you observe the child, you see that they're not like breathing or having pauses a couple seconds when they're sleeping, that could also be another sign of sleep apnea. And also bedwetting could also be a sign of sleep apnea. Having ADHD could also be related to sleep apnea. So you definitely want your doctor to evaluate the child. But it could also be a structural thing too. If they're having large tonsils or if their septum is not straight, that can also cause sleep apnea as well. And then at that time, you'll probably get a sleep study to diagnose them with sleep apnea. And then some ways to treat the sleep apnea is losing weight, having them use a nasal spray. They can have a device called a CPAP, which kind of helps them breathe and give them oxygen. And if there's like teeth grinding or something wrong with their jaw, you can have like a mouthpiece that they can wear during sleep. And if their tonsils are enlarged or the adenoids are very large, you can consider surgery to remove them. Okay, so screen time, that's probably one of the most common causes of sleep insufficiency. So do you allow your children TV or tablet in the bedroom or before bed? So it's actually a myth that TV or having a smartphone or a tablet can actually help a child wind down. It actually delays bedtime when they have screen time before bed. It takes them longer to fall asleep, and it also decreases REM sleep or deep sleep, which leads to poor quality because they're not sleeping deeply as well. The light from the screen actually arouses them. It makes them less sleepy, and they delays the circadian rhythm, therefore postponing when they feel sleepy. And how that works is that they actually suppress melatonin, which just helps us. It's produced by the brain and kind of helps us feel sleepy and want to sleep. So how do you avoid that? So you want to avoid any electronics at least 60 minutes before bed. I know sometimes you have a TV in the bedroom, so you definitely try to avoid having them use that beforehand. Making sure that the bed is only for sleep, nothing else, and no toys, no games. And you want to establish a nighttime routine early on and be consistent with it. I think you can start like a bedtime routine as early as 4 months. But if kids are watching something before bedtime, making sure it's something educational or soothing. You want to avoid anything that's violent, like shooting games or anything that's super stimulating. And other ways to help them sleep is avoid exercise 3 hours before bed. And if you have multiple children in the house, making sure it's fair and all kids have like the same sleep routine. So you have a teenager, you don't want that teen to be allowed to play games before bed, but then your 3-year-old not be able to do it. And then also as parents, we can be role models and also have like a family like timeout time or lights out, or just have like a family reading time before bed, or having coloring or just talking, board games. And then it's very important to have the same bedtime every day, even on weekends and on holidays, if, to keep the same bedtime. And then these are other routines that you can have, making sure that the room is very cool, 65 to 70 degrees, making sure it's dark and comfortable. You can also have a white noise machine if there's a lot of noise going on, or if there's like, a lot of traffic, or if some parents they work at night for the child sleeping, and then when the parent comes home at night, that can kind of disrupt their sleep because they hear the parent coming in. So having the white noise machine can kind of help drown out that noise. Or you can have, I think there's like some like lullabies that can go on for 12 hours and you have that kind of playing on a little speaker. And then you also want to avoid chocolate, caffeine, or energy drinks 6 hours before bedtime. And then anytime you want to spend times outdoors during the day, a lot of exercise during the daytime to kind of help tire them out before bed. And then for teenagers, you want to talk to them. That is very important to have enough sleep because then that'll help with their sports or their school performance. And you kind of want to monitor what they're watching too these days. And then you can also keep all electronics in the household together. Like, oh, it's 8 o'clock, let's put our electronics away and charge them together. So the kids know like, okay, this is the charging time and no more screen time. And if your child's not able to sleep after 30 minutes, you want to just get them out of bed, do something calming or like drawing or some mindful activities. And then when they get sleepy, you can kind of put them back in bed and then hopefully they'll fall asleep. But if they still don't fall asleep after 30 minutes, you kind of want to repeat the process and then until they fall asleep. And then oftentimes children sleep with their pets too, and that can also disrupt their sleep if their pet gets up at night or the pet needs to go to the bathroom. So you definitely want to keep the pet outside of their bedroom. And these are two PDFs that I found that kind of just summarizes everything that I talked about. And they have one for children and they have one for teenagers. I think it was very helpful, useful. And I can also send that to Alyssa too, if she can send that to everyone. And these are, thank you for your time. And does anyone have questions?
Any
And
questions for Dr. Lee on sleep routines? I know that with this age group, we struggle sometimes.
yeah,
So
and then this is the PDF that I mentioned. It tells you how much they should be sleeping and there's some tips here. I know it's hard because a lot of times,
Hola, yo sí tengo una pregunta. Mi hijo tiene 3 años, acaba de entrar a la escuela y obviamente por el horario ya no hace la siesta que normalmente la hacía desde la 1 hasta las 2:30. Claro que sí, ahora llega y sale a las 3 de la tarde y se duerme, algunas veces se duerme en el auto para regresar a casa hasta las 4. Entonces, me parece que esto está haciendo que mi hijo, primero, el tema de la escuela también, perdón, y el tema de la siesta le está afectando de tal manera que está agresivo y todo el tiempo, o sea, por ejemplo, ayer desde las 3 hasta las 7 de la noche estuvo llorando, estuvo enojado, estuvo muy agresivo, gritando, y esto es todos los días. A veces duerme 1 hora, pero se despierta, o sea, es otro, mi hijo ahora es otro niño. Entonces, sí me gustaría, no sé, tener alguna recomendación, qué puedo hacer, porque realmente esto para mí se vuelve insostenible. En la tarde yo no puedo disfrutar de mi hijo porque mi hijo está mal, o sea, se siente mal y entiendo que es por la escuela, el inicio de la escuela tiene 3 años y un mes exactamente, y el tema de haber dejado la siesta que lo viene siendo desde que nació. Yo he estado en el entrenamiento de su sueño. Entonces sí me gustaría tener alguna información sobre eso, por favor.
Maria, we can't hear you.
Yo no escucho.
No, I don't know if you have to. Do you have to switch?